In this video, the 5 stages of grief, also known as the Kubler-Ross model. These 5 stages can be helpful for occupational therapy practitioners to empathize and understand what the clients and their family members may be experiencing. Hi, I'm Jeff, an occupational therapist who makes content for students and new grads. Be sure to subscribe to this channel so that you do not miss a single occupational therapy video. Let's get functional. First of all, it is important to understand that not all patients go through these stages exactly as modeled. Occupational therapists should consider culture, background, context, and basically the client factors and everything in the OTPF when applying the stages of grief. Initially, this model was used to describe the stages experienced with terminal illness for the patient. In 1969, a Swiss-American psychiatrist named Elizabeth Kubler-Ross wrote in her book on death and dying that grief could be divided into 5 stages. Her observations came from years of working with terminally ill individuals. It was later applied to family members and caregivers. This model has expanded to not only terminal illness, but other things like personal losses, such as a loss of job, relationships, disease, or even something like loss of insurance. This model has recently been applied to even COVID-19 and what people may experience at different stages. Before we go into the 5 stages, it is worth noting some of the criticisms of this. The major criticism of this model is that it lacks evidence in research to support the actual stages. There have been some consistencies found with the model, but also some inconsistencies too as well. With that out of the way, let's go over the 5 stages. First is denial. Individuals believe the diagnosis is somehow mistaken. Second, we have anger. This one is pretty self-explanatory. When the individual recognizes that denial cannot continue, they become frustrated, often with those around them. Third is bargaining. It involves the hope that the individual can avoid a cause of grief in exchange for something else. Bargaining is when you wish, pray, or hope for something to change, such as a prognosis. Fourth is depression. Whereas anger and bargaining can feel very active, depression may feel more like a quiet stage of grief. Last, we have acceptance. Now, the patient has moved on past depression and is accepting of their life and the situation that they're in. In occupational therapy, we learned that patients may not experience all 5 stages of grief, nor will they necessarily move through all of these stages, especially during when you see them in therapy. As psychosocial is important in occupational therapy practice, the stages of grief can help therapists empathize and advocate for their patients. Oftentimes, we may encounter patients who are difficult, such as being in the anger stage. This is important to realize in that patients may not be themselves and they're just experiencing the various stages of emotions related to a loss or during the grieving process. Similarly, denial can be a strong barrier to rehabilitation and recovery in patients. If patients or clients and their family members are in denial, for example, it can be very difficult for them to accept, or the 5th stage, and learn to manage or cope with their condition, which may be permanent. Occupational therapists may provide their own intervention as well, or they may refer to the help of other individuals. It often takes a whole team of doctors, nurses, pharmacists, psychiatrists, psychologists, marriage and family therapists, spiritual care, and family members to help the patients recover and get better. One thing patients may experience is a relapse back into other stages, such as going back into denial or depression. I usually don't worry as much about the order of the stages, although this may be important, such as for an exam that you're taking. I like to use it to identify the types of actual stages. So I think, oh, this patient is maybe in the anger stage, but yesterday they may be in the depression stage. The order is not so much important either that they're experiencing. Whatever stage that a patient is particularly in at that time is how you and your team should plan to work with them to provide the most therapeutic interventions and outcome.